You know, there are few emergencies more terrifying than when someone just can't breathe. In that moment, when chaos and fear are taking over, there is absolutely no time for guesswork. You need a plan, a clear, precise playbook. And today, we're going to crack open that very playbook to see the step-by-step protocol that turns panic into a life-saving process. Think about that call coming into dispatch. It sends a jolt of adrenaline through the entire system. The clock is officially ticking. So let's break down exactly what happens and what a paramedic is thinking and doing in those first critical seconds. All right, here's our roadmap. First, we'll look at how first responders figure out what's going on by gathering clues and checking vital signs. Then, we'll get into their initial response and what happens when they have to step up the treatment. And finally, we'll get to the critical decision point, what the real goal of all this is out in the field. Okay, so let's dive right in. The second that 911 call for difficulty breathing comes in, it kicks off a very specific algorithm. This isn't about making a wild guess. It's a structured, methodical process designed to pinpoint the problem and start treatment, all while racing against time. Now, before they even think about giving a single medicine, the first job is to become a detective. Paramedics have to do this incredibly fast assessment to figure out what's actually happening. They're on the hunt for any clue, any little piece of information that can point them in the right direction. So that investigation, it starts with questions. Do you have a history of asthma? What about COPD, the lung disease often linked to smoking? Any heart problems? What kind of medications are you taking? Every single yes is a huge piece of the puzzle that they're trying to solve. And at the exact same time, they're looking for physical signs. Can the patient talk in full sentences, or can they only get 1 or 2 words out at a time? Are they using the muscles in their neck and chest just to try and pull in air? That's a huge red flag. Then they grab the stethoscope. What do the lungs sound like? That classic wheezing sound? That's the sound of airways squeezing shut. So, with all this data coming in, the medic's brain is just racing through a list of possibilities. It's what's called a differential, and it means they have to consider several potential causes at once before they can really act. First up, a prime suspect is asthma. With asthma, the airway gets all inflamed and constricted, which makes it incredibly tough for air to get through. This is a big one, especially with younger patients or anyone with a known history. Next on the list, they're thinking about COPD, chronic obstructive pulmonary disease. This is that long-term lung damage, usually from smoking, where the lungs just aren't as elastic as they should be. What the paramedic might be seeing is a sudden, really dangerous flare-up of that condition. Now, this one is so important. They also have to consider anaphylaxis, a severe allergic reaction. It can look almost exactly like an asthma attack, but it means a totally different and immediate treatment, epinephrine. Getting this one wrong could be fatal. And finally, could it be an infection? Something like pneumonia can fill the lungs with fluid and cause all sorts of inflammation, making it incredibly hard to breathe. The key here is that the medic can't just assume. The protocol forces them to consider all these possibilities before they make their next move. Okay, detective work is done, at least for now. It's time for action. This is where that playbook gives them clear step-by-step instructions for the first line of defense. And the protocol builds so logically. First, you take care of the most immediate problem. You give them oxygen. Then, a simple thing. Just get them into a position of comfort. Next up, the fast-acting meds to open those airways. After that, you get an IV line ready just in case you need it later. And finally, a steroid, which won't work right away but starts fighting the inflammation for the longer term. And here's the deal with oxygen. It's not just about turning it on. There's a target. The goal is to get the patient's oxygen saturation, the number they get from that little clip on their finger, up to at least 94%. It's a clear, measurable goal right in the middle of all the chaos. So let's talk about the real workhorse drug here, albuterol. This is the same stuff that's in most rescue inhalers. In the ambulance, they'll often use a nebulizer, which turns the medicine into a fine mist so the patient can just breathe it deep into their lungs. It works by directly relaxing those tiny muscles that are squeezing the airways shut, and that provides relief fast. And this is where things get really smart. They pair albuterol with another drug called ipratropium, or Atrovent. It works on a completely different chemical pathway. So think of it like a 1-2 punch. Albuterol kicks the door open, and ipratropium helps make sure it stays open longer and more effectively. It's just brilliant combination therapy. But what if it's not working? What if the patient isn't getting any better? This is a massive fork in the road, and you better believe the protocol has a plan for this exact scenario.
It's time to escalate care. This line right here, this is the trigger. It is the critical decision point. The paramedic is constantly reassessing. Are they breathing easier? Are those oxygen numbers going up? Is that wheezing sound getting better? If the answer to any of those is no after that first round of treatment, the protocol is crystal clear. It's time to bring out the bigger tools. And here they are. They might start with magnesium sulfate through the IV, which really helps relax those airway muscles even more. If that's not cutting it, they can move to CPAP. That's a mask that gently forces pressurized air into the lungs, physically propping the airways open. And in the absolute most dire situations, they turn to epinephrine. Yeah, the same drug in an EpiPen. It's a powerful system-wide jolt to open everything up as a last resort. So after all of this, from simple oxygen all the way up to these powerful IV drugs, what's the actual objective? I mean, what is the mission for the paramedic in this whole situation? And this, right here, is probably the most important takeaway of all. The goal is not to cure the patient in the back of the ambulance. The goal is stabilization. The paramedic's job is to build a bridge. They manage the immediate life-threatening crisis to get the patient safely across that bridge to the hospital where the definitive care, the real fix, can begin. This entire protocol is a truly remarkable roadmap for navigating a terrifying medical emergency. But it leaves you with a final, really important question. See, it's one thing to have the map, but what does it take for a human being to read that map, make these split-second decisions, and pull off these steps with calm precision, while a life is literally hanging in the balance? Well, that's the art behind the science.